I'm Catherine Bishop with Cato & Cato, and I'm going to talk to you guys about the medical benefit offer that is going to be available effective January 1. The good news is the plans are going to be staying exactly the same with Blue Cross and Blue Shield. I'm going to spend some time kind of talking about the highlights of the 3 different options that you have available to you. So here we go. The main thing to remember with all 3 of the options with Food Safety Net is it's really important to stay in network when and if at all possible. Blue Cross has a very, very large network of physicians and hospitals, but it's really important as a consumer when you're making that doctor's office appointment to confirm with them that they are in network with Blue Cross. Because if you simply ask the question, do you take Blue Cross? They may take anybody and bill you guys as out of network. So number 1, when you're making a doctor's office appointment, when you're getting lab work done, when you're going to an imaging center, it's very important that you guys confirm that they are in network with Blue Cross. So the first benefit we're going to talk about, or the first option, is the high deductible health plan. So we've had this in force for several years with Food Safety Net. So hopefully most of you guys are familiar with it, but if you're not, it is pretty much what it says it is. It is a high deductible health plan where the majority of your healthcare costs are going to track towards that deductible. Once that deductible is met, you're going to pay a percentage until the out-of-pocket is met. So we're going to talk a little bit about how that works. So if you're looking in your guide at the benefit options, you're going to see the first thing under high deductible health plan is preventive care. It's really important to understand under this option that preventive care is covered at 100%. The guide shows a 0%. That means you guys pay absolutely nothing for your preventive care. The second thing I want to talk about is office visits. So if you're on this high deductible health plan and you're going to a primary care doctor or a specialist, you're going to pay the negotiated rate of the cost of that visit. So for example, if you go to a specialist and without insurance they charge $250, but because they're contracted with Blue Cross, let's say that's reduced down to $150. That $150 is going to track towards your deductible. The deductible on this plan is a $3,000 calendar year deductible. So it's really important to remember that all of those expenses are going to track towards that $3,000 deductible. The other option that I want to mention to you guys is something that's becoming more and more popular, which are called virtual visits. So Blue Cross has a partnership with a company called MD Live, where you as a member or anyone in your household that's a member has access to FaceTime with a physician 24 hours a day. So if you wake up and you look like you have pink eye, but you don't have time to go schedule a doctor's office appointment, get into the doctor to confirm that you have pink eye, you can actually set up a virtual visit where the doctor can look at you, confirm you have pink eye. They will charge you whatever the negotiated rate of that cost of that visit is, and then they will call you in a prescription. So it is a fantastic resource. I highly encourage everybody who thinks that they might ever use this service to go ahead and get in touch with MD Live, provide all of your information so that when and if you actually need to utilize this service, you're not filling out a bunch of paperwork online when you're not feeling very well. So remember the virtual visit. So as I mentioned earlier, on this plan you have a $3,000 calendar year deductible. Once you have met that deductible, the plan is going to pay 90%, you're going to pay 10% until you've reached a maximum out of pocket of $6,000. So I'd like to kind of give a real life example to put this in perspective. So I'm not sure if you guys know this, but if somebody were to have a heart attack, the average cost of a heart attack bill today is between $100,000 and $150,000. That's a very large number. So if you were participating on this high deductible health plan, the way that would work is you would be responsible for the first $3,000 of that deductible, and then you would pay 10% of the remainder of that bill up to a max of $6,000. So instead of a $150,000 hospital bill, your maximum out of pocket is going to be reduced to $6,000. And then any additional expenses you have on top of that will be covered at 100%. That kind of explains how that maximum out-of-pocket works. We have in here inpatient and outpatient benefits, kind of just hit on that. Anything you do inpatient is going to track towards that $3,000 deductible, and then you're going to pay your 10% coinsurance. Same thing on an outpatient basis. If you need outpatient knee surgery, it's going to track towards that deductible, and then you're going to pay 10% of the remainder of the bill. Emergency room. So the emergency room benefit works the same way. Anytime you go to the emergency room, you're going to pay the negotiated rate of the cost of that emergency room. If it is a true life-threatening emergency, we highly encourage you guys to go to the emergency room. But if you wake up on a Sunday morning and you feel like you have the flu, please don't go to the emergency room. It's going to cost you guys so much more than if you go to an urgent care or do the virtual visit. There are a lot of different options that are out there. So just keep that in mind when you're talking about emergency room. One of the things that we see all over the country are what we call freestanding emergency centers. Basically, they are emergency rooms that are not physically connected to a hospital, but they bill the same as an emergency room would. So it is very important, if you guys think you're going to an urgent care clinic, which is different than a freestanding emergency room, that you make sure it doesn't say emergency services in the name, because what we found is if it says emergency services somewhere in the name, most likely you guys are going to be billed emergency room prices. Urgent care, which I mentioned, is a great alternative. A lot of times these are open extended hours as opposed to your doctor's office. You can go there for almost anything unless it's a true life-threatening emergency. So they can treat strep throat, the flu, broken bones. They can do imaging scanning and things like that. So it's definitely going to be a lot less expensive to attend an urgent care facility versus the emergency room. So I would encourage everybody to go online and figure out through Blue Cross what urgent care clinics are near your house, near your work, so that in the event something comes up, you know exactly where to go in network, as opposed to having to think about it when you're in the middle of the situation. Lab and x-ray benefits, so this does track towards your deductible as well on the high deductible health plan. So if you need to go get routine blood work or you need a simple x-ray, it is going to track towards your deductible. Same thing with an advanced image. An advanced image is your MRIs, your CAT scans, your PET scans. Those are going to track towards your deductible as well. The last thing I want to mention on the high deductible health plan are prescriptions. So this works a little different than a traditional copay plan that we'll talk about in a few minutes. Under a high deductible health plan, when you go get your prescriptions filled, you're actually paying the cost of that prescription up to your deductible. So a great resource that I highly encourage all of you guys to look into is something called GoodRx. GoodRx is a great website. They also have an app where you can actually type in your medication, how many milligrams you're taking, and it will pull up the cost of that medication at all of the different pharmacies in your city. And you will be shocked at the results. I would have thought that they're all pretty much the same price, and that is definitely not the case. So it's important for you guys to look at that information, especially if you're on the high deductible health plan, because you can find your prescriptions possibly at a lower cost pharmacy. The other thing I would mention about prescriptions is coupons. So a lot of times also on that GoodRx website, they have coupons listed for particular medications that you can print, take to the pharmacy, and sometimes will offset what you guys are actually paying out of pocket. I also encourage you to ask your doctor, pediatricians, so forth, if they have coupons to offset any of the medications that they're prescribing you or your dependents, because a lot of times they do, and it can reduce what you guys are actually spending at the pharmacy. The last piece of pharmacy is specialty pharmacy. So specialty drugs are becoming extremely expensive. These drugs may cost several $1,000s a month. But the great thing about specialty pharmacies is there are a lot of assistance programs out there to help offset what you guys are actually paying in pharmacy cost. So if you have a question about a specific specialty med and you're needing some assistance and you don't really know where to go, please reach out to us at Cato. We're happy to help in any way, research so that you guys are paying the least amount of money you possibly can for these prescription medications. So that's kind of the high level overview of that high deductible health plan. You know, the benefit to the high deductible health plan is you have an opportunity to set up a health savings account, which we'll talk about a little bit later on in the presentation. But that's kind of the highlights on that one. So the base option or the middle option listed in your enrollment guide is a more traditional copay plan. Again, you will see preventive care is covered at 100%. You guys pay nothing when you go get your annual physicals. If you're going to see a doctor on this plan, if it's a primary care doctor, it's a $35 copay. If it's a specialist, it's a $60 copay. The main thing to remember is that you guys do not have to have a referral to see a specialist. So if you need to go to a specialist, fantastic. Just make sure that they're in network with Blue Cross. The virtual visit option on this plan is a $35 copay. So if you utilize the MD Live service, you're going to pay $35 under this base PPO option. Your calendar year deductible is $3,500, so a little bit higher than what we talked about on the previous high deductible health plan. However, once you meet that $3,500, the plan pays 80%, you pay 20%, to a maximum out of pocket of $6,600. So our $150,000 heart attack example, your maximum out of pocket on this plan would be $6,600. Inpatient and outpatient surgeries track toward deductible and coinsurance. And then the emergency room benefit on this plan is a $300 copay to walk in the door of the emergency room. And then it's going to be subject to your deductible and coinsurance. So again, unless it's a true life-threatening emergency, I highly encourage you guys to try to stay out of the emergency room. The urgent care copay on this plan is a $75 urgent care copay, which is great. And your routine lab and x-ray is covered at 100%. That is a great benefit associated with this option. Your advanced imaging, your MRIs, your CAT scans, your PET scans, those still do track towards the deductible, and then you would pay 20% after that. And for your prescriptions, you have a 3-tier drug card. So as you guys probably know, Blue Cross has a list of medications. That medication is divided into different tiers. So if your medication falls under tier 1, it's going to be a $15 copay for a 30-day supply. Tier 2, it's going to be a $50 copay. Usually these are brand name medications. And tier 3 is going to be a $90 copay. Usually these are your more expensive brand name medications that you guys see advertised on TV. If you do or take a maintenance medication and you would like to order it through the mail, you absolutely have that option to do that, where you get a 90-day supply for 2.5 copays. So you save half a copay, and you have the convenience of having the prescription mailed to you every 90 days, so you don't have to go to the pharmacy and pick it up every 30 days. So that's a great option to look into. And as I mentioned, you know, your maximum out of pocket on this plan is $6,600. It's important to remember that includes your deductible, your coinsurance, and all of your copays. So that's a true maximum out of pocket. So $6,600 for the individual and $13,200 for the family. So the final option I'm going to mention is the buy-up PPO option. Again, consistent theme, preventive care is covered at 100%. You guys pay nothing out of pocket for that. So go get your annual physicals. Office visit copays, they're a little bit lower. They're $25 for primary care and $50 for a specialist. And your virtual visit with MD Live on this plan is going to be a $25 copay. Your calendar year deductible is a $1,500 deductible on this plan, and then the coinsurance is 100%. So we talk about that heart attack example again. You have a $150,000 claim. You're going to be responsible for the first $1,500 of that, and then the plan's going to pay 100%. You will notice the bottom of that section, you see a maximum out of pocket of $3,000. That would be your deductible and then an additional $1,500 in copays to satisfy that $3,000 max. So you would have to have a fair amount of copays to hit that 3,000, but if you did, that would be your worst case scenario. The emergency room benefit, again, you have that $300 copay and then deductible and co-insurance and a $75 urgent care. Lab and x-ray, 100% benefit. If it's an advanced image, like an MRI, CAT scan, PET scan, those do go towards the deductible. The prescription plan works the exact same way as that mid option. You have $15 for tier 1, $50 for tier 2, and $90 for tier 3. And those are the options for your medical plan.